Maternal and fetal well-being. So the health of a fetus and the health of the mother are inextricably linked. So generally, a woman who eats well and takes care of her own health during pregnancy provides a healthy environment for fetal growth and development. So however, she may need instructions on what exactly constitutes a healthy lifestyle for herself and her baby. So most women have questions regarding how much extra rest they need, what type of exercise they can continue, and whether all the changes going on in their bodies, some of which bring them daily discomfort, are normal. So therefore, education plays a major role in promoting maternal and fetal health. But before everything, I am going to introduce the reporters in this presentation. So, we have here Sarah May Candelaza, Reina May Tagalog, Tara Isabel Faison, and yours truly, Renmei Hansen. Next is the fetal growth and development. So in just 38 weeks, a fertilized egg matures from a single cell to a fully developed fetus ready to be born. So fetal growth and development are typically divided into three periods. First is the pre-embryonic, which is first 2 weeks beginning with fertilization, and then embryonic, weeks 3 through 8, then fetal from week 8 to birth. Fertilization, the beginning of pregnancy. So fertilization, also referred to as the conception and impregnation, is the union of an ovum and spermatozoon. So this usually occurs in the outer third of a fallopian tube, the amphilar portion. Then it usually only one of the woman's ova will reach maturity each month. So once a mature ovum is released, fertilization must occur fairly quickly because an ovum is capable of fertilization for only 24 hours or 48 hours at the most. So the functional life of a spermatozoon is also about 48 hours, possibly as long as 72 hours. So the total critical time span during which sexual relation must occur for fertilization to be successful is about 72 hours. So ejaculation of semen averages 2.5 ml of fluid containing 50 to 200 million spermatozoa per liter, or an average of 400 million sperm per ejaculation. So sperm transport is so efficient close to the ovulation that spermatozoa deposited in the vagina generally reach the cervix within 90 seconds and the outer end of a fallopian tube within 5 minutes after deposition. So under ordinary circumstances, only one spermatozoon is able to penetrate the cell membrane of the ovum. Once it penetrates the cell membrane changes composition to become impervious to other spermatozoa. Immediately after penetration of the ovum, the chromosomal material of the ovum and spermatozoon fuse to form a zygote. Next is the implantation. So once fertilization is complete, a zygote migrates over the next 3 to 4 days toward the body of the fetus, aided by the currents initiated by the muscular contraction of the fallopian tube. So during this time, mitotic cell division or cleavage begins. So the first cleavage occurs at about 24 hours. Cleavage division continues to occur at a rate of about 1 every 22 hours. So by the time the zygote reaches the body of the uterus, it consists of 16 to 50 cells. So at this stage, because of its bumpy outward appearance, it is termed a morula, which is from the Latin words morus, meaning mulberry. Once it reaches the uterus, the morula becomes a blastocyst. The blastocyst then burrows into the uterine lining. So it is a process called implantation. Then now let's proceed to embryonic and fetal structures. So first is the decidua. So after fertilization, the corpus luteum in the ovary continues to function rather than atrophying because of the influence of human chorionic gonadotropin or HCG. So it is a hormone secreted by the trophoblast cells. So this causes the uterine endometrium to continue to grow in thickness and vascularity. So instead of sloughing off as in a usual menstrual cycle, the endometrium is now termed decidua, the Latin word for falling off, because it will be discarded after the birth of the child. So decidua has three separate areas. So first is the decidua basalis, which the part of the endometrium that lies directly under the embryo, or the portion where the trophoblast cells establish communication with maternal blood vessels. And then second is the decidua capsularis, the portion of the endometrium that stretches or encapsulates the surface of the trophoblast. So decidua vera. Third is the decidua vera, which the remaining portion of the uterine lining. The next is the chorionic villi. So once implantation is complete, the trophoblastic layer of cells of the blastocyst begin to mature rapidly. As early as the 11th or 12th day, miniature villi that resemble probing fingers, termed chorionic villi, reach out from the single layer of cells into the uterine endometrium to begin formation of the placenta. At term, almost 200 such villi will have formed. All chorionic villi have a central core of connective tissue and fetal capillaries. So a double layer of trophoblast cells surrounds these. So the outer of the two covering layers is the syncytiotrophoblasts or syncytial layer. So these layer cells produce various placental hormones such as HCG, somatotropin or human placental lactogen, and then estrogen and progesterone. So the middle layer, the cytotrophoblasts or Langerhans layer, is present as early as 12 days gestation. It appears to function early in pregnancy to protect the growing embryo and fetus from certain infectious organisms such as spirochete or syphilis. Next is the placenta. So the placenta is Latin for pancake, which is descriptive of its size and appearance at term, arises out of the continuing growth of the trophoblast tissue. So its growth parallels that of the fetus, growing from a few identifiable cells at the beginning of pregnancy to an organ 15 to 20 centimeter in diameter and 2 to 3 centimeter in depth, covering about half of the surface area of the internal uterus at term. The next is the circulation. So as early as the 12th day of pregnancy, maternal blood begins to collect in the intervillous spaces of the uterine endometrium surrounding the chorionic villi. So by the third week, oxygen and other nutrients such as glucose, amino acid, fatty acid, minerals, vitamins, and water osmose from the maternal blood through the cell layer of the chorionic villi into the villi capillaries. So from there, nutrients are transported to the developing embryo. Placental osmosis is so effective that all except a few substances are able to cross from the mother into the fetus. Because almost all drugs are able to cross into the fetal circulation, it is important that a woman take no to non-essential drugs, including alcohol and nicotine, during pregnancy. The next is the endocrine function. So aside from serving as the conduit for oxygen and nutrients for the fetus, the syncytial or the outer layer of the chorionic villi developed into separate important hormone-producing system. So human chorionic gonadotropin is the first placental hormone produced. So HCG can be found in maternal blood and urine as early as the first menstrual period, shortly after implantation has occurred. So through about the 100th day of pregnancy. So the purpose of HCG is to act as a fail-safe measure to ensure that the corpus luteum of the ovary continues to produce progesterone and estrogen. So this is important because if the corpus luteum should fail and the level of the progesterone fall, the endometrial lining will slough and the pregnancy will be lost. So HCG almost play a role in suppressing the maternal immunologic response so that placental tissue is not detected and rejected as a foreign substance. The next is the estrogen. So estrogen is the primarily estriol. It's produced as a second product of the sexual cells of the placenta. So estrogen contributes to the woman's mammary gland development in preparation for the lactation and stimulates uterine growth to accommodate the developing fetus. The next is the progesterone. So estrogen is often referred to as the hormone of women and the progesterone as the hormone of mothers. So this is because although estrogen influences a female appearance, progesterone is necessary to maintain the endometrial lining of the uterus during pregnancy. So it is present in serum as early as the 4th week of pregnancy as a result of the continuation of the corpus luteum. So this hormone also appears to reduce the contractility of the uterus during pregnancy. So preventing premature labor, such reduced contractility is probably produced by a change in electrolytes, which decreases the contraction potential of the uterus. Next is the human placental lactogen, which is the human chorionic somatotropin. So HPL is a hormone with both growth promoting and lactogenic, so milk producing properties. So it is produced by the placenta beginning as early as the 6th week of pregnancy, increasing to a peak level at term. So it promotes mammary gland or the breast growth in preparation for the lactation in the mother. So it also serves as the important role in regulating maternal glucose, protein, and fat levels so that adequate amounts of these nutrients are always available for to the fetus. The next is the amniotic membrane. So the amniotic membranes or amnion forms beneath the chorion. So at birth, they can be seen covering the fetal surface of the placenta, giving the surface its typically shiny appearance. So there is no nerve supply. So when they spontaneously rupture at term or are artificially ruptured, neither woman nor child experiences any pain. So the amniotic membrane not only offers support to the amniotic fluid, but also actually produces the fluid. So in addition, it produces a phospholipid that initiates the formation of prostaglandin, which can cause uterine contraction and may be the trigger that initiates labor. The next is the amniotic fluid. So amniotic fluid is constantly being newly formed and reabsorbed by the amniotic membrane. So it never becomes stagnant. The major method of absorption, however, occurs because the fetus continually swallows the fluid in the fetal intestine. It is absorbed into the fetal bloodstream. From there, it goes to the umbilical arteries and to the placenta, and it is exchanged across the placenta. So at term, the amount of amniotic fluid has increased so much. It ranges from 800 to 1,200 ml. So the most important purpose of the amniotic fluid is to shield the fetus against the pressure or a load to the mother's abdomen. So because liquid changes temperature more slowly than air, so it also protects the fetus from changes in temperature. Amniotic fluid is slightly alkaline with a pH of about 7.2. Next is the umbilical cord. So umbilical cord is formed from the fetal membrane, the amnion, and the chorion, and provides a circulatory pathway that connects the embryo to the chorionic villi of the placenta. So its function is to transport oxygen and nutrients to the fetus from the placenta and to return waste products from the fetus to the placenta. So it is about 53 centimeter or 21 inches in length at term and about 2 centimeter or 3/4 inches thick. An umbilical cord contains only one vein, so carrying blood from the placental villi to the fetus, but arteries carrying blood from the fetus back to the placental villi. So the rate of blood flow through an umbilical cord is rapid, which is 300 ml to 300 ml per minute at. Then now, let's proceed to origin and development of organ systems. So following the moment of fertilization, the zygote and later the embryo and fetus continues with active growth. The first is the stem cells. So during the first 4 days of life, zygote cells are termed totipotent stem cells, or cells that are so undifferentiated they have the potential to form a complete human being. So in another 4 days, as the structure implants and becomes an embryo, cells begin to show differentiation and lose their ability to become any body cell. So instead, they are now slated to become specific body cells, such as nerve, brain, or skin cells, and are termed pluripotent stem cells. In yet another few days, the cells grow so specific that they are termed multipotent, or are so specific that they have set a sure course toward the body organ they will create. The next is the zygote. So from the beginning of fetal growth, development proceeds in a cephalocaudal, which is head to tail direction. That is, head development occurs first and is followed by development of the middle and finally the lower body parts. So this pattern of development continues after birth, as shown by the way infants are able to lift up their hands approximately 1 year before they are able to walk. So as fetus grows, body organs system develop from specific tissue layers called the germ layers. Then now let's proceed to the germ layers. So at the time of implantation, a blastocyst already has differentiated to a point at which two separate cavities appear in the inner structure. So first is the large one, the amniotic cavity, which is lined with a distinct layer of cells, the ectoderm, and then a smaller cavity, the yolk sac, which is lined with endoderm cells, and between the amniotic cavity and the yolk sac, a third layer of primary cells, the mesoderm, forms. So in human, the yellow sac appears to supply nourishment only until implantation. So after that, its main purpose is to provide a source of red blood cells until the embryo's hematopoietic system is mature enough to perform this function at about 12 weeks of intrauterine life. The next is the cardiovascular system. So the cardiovascular system is one of the first systems to become functional in intrauterine life. Simple blood cells, joined to the walls of the yolk sac, progress to become a network of blood vessels and a single heart tube, which forms as early as the 16th day of life and beats as early as the 24th day. So the septum that divides the heart into chambers develop during the 6th or 7th week. So heart valves begin to develop in the 7th week. So the heartbeat may be heard with a Doppler instrument as early as the 10 to 12 week of pregnancy. The next is the respiratory system. So at the 3rd week of intrauterine life, the respiratory and digestive tracts exist as a single tube. So like all the body tube, initially this forms as a solid structure, which is then canalized or hollows out. So by the end of the 4th week, a septum begins to divide the esophagus from the trachea. At the same time, lung buds appear on the trachea until the 7th week of life. So the diaphragm does not completely divide the thoracic cavity of the abdomen. So this causes lung buds to extend down in the abdomen, re-entering the chest only as the chest longitudinal dimension increases and the diaphragm becomes complete at the end of the 7th week. Other important respiratory developmental milestones, so these are alveoli and capillaries begin to form between the 24th and 28th weeks. So both capillary and alveoli development must be complete before gas exchange can occur in the fetal lungs. Spontaneous respiratory practice movements begin as early as 3 months gestation and continue throughout pregnancy. And then specific lung fluid with a low surface tension and low viscosity forms in alveoli to aid in expansion of the alveoli at birth. So it is rapidly absorbed after birth. Then next is the surfactant. So surfactant is a phospholipid substance is formed and excreted by the alveolar cells at about the 24th week of pregnancy. Next is the nervous system. So like the circulatory system, the nervous system begins to develop extremely early in pregnancy. So during the 3rd and 4th weeks of intrauterine life, possibly before the woman even realizes she is pregnant, active formation of the nervous system in sense organ has already begun. So a neural plate, which is a thickened portion of the ectoderm, is apparent by the 3rd week of gestation. So the top portion differentiates into the neural tube, which will form the central nervous system, which is the brain and spinal cord, and then the neural crest, which will develop into the peripheral nervous system. So all parts of the brain, the cerebrum, cerebellum, pons, and the medulla oblongata forms in utero. And then, although none are completely mature at birth, growth proceeds rapidly during the first year and continues at high levels until 5 or 6 years of age. So the eye and the inner ear develop as projection of the original neural tube. So by 24 weeks, the ear is capable of responding to sound. The eye exhibits a papillary reaction, indicating the sight is present. And then brain waves can be detected on an electroencephalogram or EEG by the 8th week. Next is the endocrine system. So as soon as endocrine organs mature in intrauterine life, function begins. So the fetal adrenal glands supply a precursor necessary for estrogen synthesis by the placenta. So the fetal pancreas produces insulin needed by the fetus. So insulin is one of the few substances that does not cross the placenta from the mother to the fetus. And then thyroid and parathyroid glands play vital roles in fetal metabolic function and calcium balance. So the digestive tract separates from the respiratory tract at about the 4th week of intrauterine life, and after that begins to grow extremely rapidly. Initially solid, the tract canalizes or hollows out to become patent. So atresia or blockage or stenosis can develop if either the first or second canalization does not occur. Because of this rapid intestinal growth, by the 6th week of intrauterine life, the intestine becomes too large to be contained by the abdomen. So a portion of the intestine, guided by the vitelline membrane, which is the part of the yolk sac, is pushed into the base of the umbilical cord, where it remains until about the 10th week. So when the abdominal cavity has grown large enough to accommodate the intestinal mass again, the next is the meconium. So meconium is a collection of cellular waste, bile, fats, mucoproteins, mucopolysaccharides, and portions of the vernic gaseosa, the lubricating substance that forms on the fetal skin. It accumulates in the intestine as early as the 16th week. So meconium is sticky in consistency and appears black or dark green, obtaining its color from bile pigment. So the gastrointestinal tract is sterile before birth because vitamin K is synthesized by the action of bacteria in the intestine. Vitamin K levels are low in the newborn. Musculoskeletal system. So during the first 2 weeks of fetal life, cartilage prototypes provide position and support. Ossification of this cartilage into bone begins at about 12 weeks. Ossification continues all through fetal life and actually until adulthood. So carpals, tarsals, and sternal bones generally do not ossify until birth is imminent. So a fetus can be seen to move on an ultrasound as early as the 11th week, although the woman usually does not feel this movement or the quickening until almost 20 weeks of gestation. Next is the reproductive system. So a child's sex is determined at the moment of conception by a spermatozoon carrying an X or a Y chromosome and can be ascertained as early as 8 weeks by chromosomal analysis. At about the 6th week of life, the gonads or the ovaries or testes form. So if testes form, testosterone is secreted, apparently influencing the sexually neutral genital duct to form other male organs. In the absence of testosterone secretion, female organs will form. If deficient testosterone is secreted by the testes, both the Mullerian or female duct and the male Wolffian duct could develop pseudohermaphroditism or intersex. Next is the urinary system. Kidney are present as early as the end of the 4th week of intrauterine life. The presence of kidneys does not appear to be essential for life before birth because the placenta clears the fetus of waste products. So the complex structure of the kidney is gradually developed during intrauterine life and continues for months afterward. Urine is formed by the 12th week and is excreted into the amniotic fluid by the 16th week of gestation. Glomerular filtration and concentration of urine in the newborn are not efficient because the kidney function is still not mature at birth. So early in the embryonic stage of the urinary system development, the bladder extends as high as the umbilical region. On rare occasion, an open lumen between the urinary bladder and the umbilicus fails to close. It is termed a patent urachus. This is discovered at birth by the persistent drainage of a clear acid pH fluid or urine from the umbilicus. The next is the integumentary system. So the skin of a fetus appears thin and almost translucent until subcutaneous fat begins to be deposited at about 36 weeks. So skin is covered by soft downy hairs, which is lanugo, that serve as insulation to preserve warmth in the utero, and a cream cheese-like substance, the vernica caseosa, which is important for lubrication and for keeping the skin from macerating in utero. The next is the immune system. So immunoglobulin G, IgG, antibodies cross the placenta and the fetus as early as the 20th week and certainly by the 24th week of intrauterine life to give a fetus temporary passive immunity against disease for which the mother has antibodies. So infants born before antibody transfer has taken place have no natural immunity and need more than the usual protection against infectious disease in the newborn period. The level of these acquired passive IgG immunoglobulins peak at birth and then decreases over the next 8 months as the infant builds up his or her own storage of IgG, as well as a IgG and IgM. A fetus is capable of active antibody production late in pregnancy. Generally, this is not necessary, however, because antibodies are manufactured only after stimulation by an invading antigen, and antigens rarely invade the intrauterine space. Then now, let's have our game time, which is entitled Identify Me. So I am going to show you a statement and read it for you. So all you have to do is to identify what is being asked. Then now, let's get started. Number 1. It is the union of an ovum and a spermatozoon and is referred to as conception and impregnation. If your answer is fertilization, you are correct. Then, let's proceed to number 2. So, it is formed from the fetal membranes, amnion and chorion, and provides a circulatory pathway that connects the embryo to the chorionic villi of the placenta. If your answer is umbilical cord, you are correct. Then now, let's proceed to number 3. So it is the Latin for pancake, which is descriptive of its size and appearance at term, arises out of the continuing growth of the trophoblast tissue. If your answer is placenta, you are right. Then now, let's proceed to number 4. So, it referred as the hormone of mothers and is necessary to maintain the endometrial lining of the uterus during pregnancy. If your answer is progesterone, you are correct. Then lastly, number 5. So it is a soft, downy hair that covers the skin and serves as insulation to preserve warmth in the utero, and a cream cheese-like substance that is important for lubrication. So if your answer is lanugo and vernix caseosa, you are correct. Good job, everyone.
So now I'm going to discuss the milestones of fetal growth and development. So fetal growth and development is the process of prenatal development, occurs in three main stages. The first 2 weeks after conception are known as terminal stage. The third through the eighth week is known as the embryonic period, and the time from the ninth week until birth is known as the fetal period. So next. So first we have the end of the fourth gestational week. The length of the embryo is about 0.75 centimeters and the weight is about 400 milligrams. So the spinal cord is formed, fused at the midpoint. The head is large in proportion and represents about 1/3 of the entire structure, and the rudimentary heart appears as a prominent bulge of the anterior surface, and the arms and legs are bud-like structures, and the rudimentary eyes, ears, nose are discernible. So we can see here in the picture. So for the end of the eighth gestational week, the length of the fetus is about 2.5 centimeters, 1 inch. Weight is about 20 grams. So the organogenesis is now complete. The heart with a septum and valves beats rhythmically. Facial features are discernible, and the arms and legs have developed. So the external genitalia is forming, but sex is not yet distinguishable by simple observation. So the abdomen bulges forward because a fetal intestine is growing rapidly. So a sonogram will show the gestational sac, which is a diagnostic of pregnancy. So we can use the a sonogram here. So we can see here in the picture, look at this. Okay. So next is the end of the 12th gestational week, the first trimester. For the end of the first trimester. So the length of the fetus is 7 to 8 centimeters, and the weight is about 4 to 5 grams. Nail beds are forming on fingers and toes. Spontaneous movement are possible, although they are not felt by the mother, because it is too faint to be felt by the mother. So some reflexes such as the Babinski reflex are present. So Babinski reflex is one of the normal reflexes in infants. Reflexes are responses that occur when the body receives a certain stimulus. The Babinski reflex occurs after the sole of the foot have been firmly stroked. That's for so the tooth buds are present, bone ossification centers begin to form, sex is distinguishable on outward appearance, urine secretions begins but not yet evened and amniotic fluid, and heartbeat is audible through Doppler technology. So next is we have the end of the 16th gestational week. So the length of the fetus is 10 to 17 centimeters and the weight is 55 to 120 grams. The fetal sounds are now audible by ordinary stethoscope and now the lanugo is well formed. So we can see here in the picture. Both the liver and pancreas are functioning and then the fetus actively swallows amniotic fluid although it demonstrates that it is intact, but it is uncoordinated stalling reflex, and the urine is now present in the amniotic fluid. So sex can be determined also by the ultrasonography. So you can use that ultrasonography to determine the sex of the fetus. So we can see here in the picture. Look at that. Okay. So next is the end of 20th gestational week. So the length of the fetus now is 25 centimeters and the weight is 223 grams. Look at the picture. So spontaneous fetal movements can be sensed by the mother. Antibody production is possible. Hair, including the eyebrows, form on the head, and vernix caseosa begins to cover the skin. So meconium is present in the upper intestine, and brown fat, a special fat that aids in temperature regulation, begins to form behind the kidneys, sternum, and the posterior neck. So positive antibody transfer from mother to fetus will also begin. So definite sleeping and activity patterns are distinguishable as the fetus will develop biorhythms that will guide sleep-wake patterns throughout life. Okay. So just observe this. Okay. So for the end of 24th gestational week, second trimester, the length of the fetus now is 28 to 36 centimeters and the weight is 550 grams. So the meconium is present as far as the rectum. Active production of lung surfactants begins. The eyelids previously fused in 12th week now open and the pupil will react to light. So hearing can be demonstrated by a response to sudden sound, and when the fetus will reach the 24 weeks or 500 to 600 grams, they have achieved a practical low and age of viability if they are cared for after birth in a modern intensive care nursery. So can live by the mother through this technology, the in technology in modern intensive care nursery. So if they are cared there, okay. So it is called the practical low and age of viability. So next is the end of 28th gestational week. So the fetus now the length of the fetus is 35 to 38 centimeters and the weight is about 1,200 grams. So the lung alveoli is almost mature. Surfactants can be demonstrated in amniotic fluid. Testes begin to descend into the scrotal sac from the lower abdominal cavity, and the blood vessels of the retina are formed but thin and extremely susceptible to damage from high oxygen concentration. So it is an important consideration when caring for preterm infants who need oxygen. So because the blood vessel retina is easily damaged, so we need to be careful. We need to consider this. So you can see here in the picture. Okay. So next is the end of the 32nd gestational week. So the length of the fetus now is 38 to 43 centimeters. The weight is 1,600 grams. Subcutaneous fat begins to be deposited. The former stringly, like the appearance is like a little old man. That is it. And the fetus responds by movement to sounds outside the mother's body. So the previous slides we mentioned the fetal movement, but this time the fetus will respond through outside sound like that. So this time, uh, active motor reflex is present, and the iron stores which provide iron from the time during which the neonate will ingest only breast milk after birth are beginning to be built, and the fingernails reach at the end of the fingertips. So, fully formed ng fingernails this time. Okay? Makita na dyan siya. So, makita dyan rin na to ng picture. Okay? So next we have the end of the 36th gestational week. So the length of the fetus is 42 to 48 centimeters, and then the weight of the is 1,800 to 2,700 grams, or 5 to 6 pounds. So the body stores a glycogen, iron, carbohydrate, and calcium are deposited. Additional amounts of subcutaneous fat are deposited. Sole of the foot has only 1 to 2 crisscross crosses compared with full crisscross pattern even at term, and amount of lanugo begins to diminish. So most baby turns into vertex head down presentation during this month. So look at the picture. Head down siya na siya sa kung okay. So next is the third trimester, the end of 40th gestational week. The length of the fetus is 48 to 52 centimeters, crown to rump 35 to 37 centimeters. Weight is 3,000 grams, 7.5 pounds. The fetus will actively kicks the mother, sometimes hard enough to cause the mother considerable discomfort because this time ang fetus kay masigin siya kick. So the fetal hemoglobin begins to conversion to adult hemoglobin, and the vernix caseosa is fully formed. Look at the picture, okay? And the fingernails rather, extend over the fingertips, and the crosses of the soles of the feet cover at least 2/3 of the surface. So kita mo na, look at the soles of the feet, okay? Then the vernix caseosa fully formed na. Okay. Then ang crown to rump. Okay, so that is for the third trimester. So yeah, that's all for the fetal growth and development for of the fetus. So next topic is about determination of estimated birth date. So I know that we have been repeatedly discussing about this, the determination of um estimated birth date. So estimated birth date can be calculated by um to calculate this, the date of birth by this rule is count backwards 3 calendar months, so minus 3 months from the first day of the woman's last menstrual period, and add 7 days, and also you can add 1 year if wala siya sa January, February, or March. And then so we have here the example. So before, the estimated due date, or the EDC or EDD due date, EDD, is the date that spontaneous onset on labor expected to occur. So the due date may be estimated by adding before. So we're using this the Nagel's rule. So by adding 280 days, 9 months, and 7 days to the first day of last menstrual period, or the LMP. This is the method used by the pregnancy wheels. So kita mo ng picture. So per this time I have a example. So to calculate this month of period, atong basihan ng last menstrual period. So So the example here is the May 21, 2019. So May is 5. So last period then plus 7 days and plus 1 year. So 5 minus 3 equals 2, which is February. 21 plus 7 is 28. Then 2019 is plus 1 is 2020. So we have February 28, 2020. So that is the estimated birth date. So the mother and the healthcare professionals will get ready for that. So that's it for the calculation. So we've been discussing about this. So I think you know this stuff. So next is a game. So the game is called Guess Me. So I'm going to paste a picture and describe the picture regarding the topic. So it is about the milestone of the fetal growth and development. So and ask you guys what and you need to guess what is the picture all about and the description. Okay, so let's start everyone. So we have here number one. So the length of embryo is about 0.75 centimeters and the weight is about 400 milligrams. And the spinal cord is formed and fused at the midpoint. So if you listened earlier, you'll definitely answer this. Look at the picture. Look at the embryo. It is still tiny, like really too tiny. And look at the development of the embryo. Okay. So what do you think is the answer, everyone? Okay. You're absolutely right. The answer is the end of the fourth gestational week. Okay, very good. Look at this. So it is the end of fourth gestational week. So number two, let's proceed. Okay. The length of the fetus is 48 to 52 centimeters, crown to rump 35 to 37 centimeters, and the weight is 3,000 grams, 7 to 77.5 pounds, and the vernix caseosa is fully formed. Look at this. Look at the picture. Look at the fetus. So drop your guess, everyone. Which gestational week is this? And kindly specify what is it. Okay, we'll give you time. Okay, so you're right. You got it right. It is the end of 40th gestational week, the third trimester. So thank you so much for listening to me. I hope you learned something today, and we're going to proceed to the next reporter. Thank you so much and have a good day, everyone. Thank you.
Good day to all. So now we are down with the diet, supplement, and nutritional needs that will be tackled by yours truly, me. So at the end of this lecture, you're about to know the relationship of maternal nutrition and fetal health, recommended weight gain during pregnancy, and the components of healthy nutrition for the pregnant women. So the relationship of maternal nutrition and fetal health. So during pregnancy, a woman must eat adequately to supply enough nutrients to the fetus so it can grow as well as to support her own nutrition. So adequate protein and calcium intake is vital. Why? Because so much is needed by a fetus to build a body framework. And adequate protein may also help prevent complications of pregnancy such as pregnancy-induced hypertension or preterm birth. So pregnancy provides opportune nutrition teaching moments as a woman finds herself suddenly more interested in her weight and well-being than usual. So be careful when nutrition counseling not to make general statements. So we must avoid general statements such as eat high protein foods because food in the supermarket after all is not labeled high protein. But instead, we must um, we must provide advice whenever possible in more specific terms such as eat 4 servings for 3 of some type of meat or fish every day. So the word diet has come to mean a form of unpleasant food denial rather than a pregnancy diet. Therefore, talk about foods that are best for you during or pregnancy nutrition. So next, so to this is the recommended weight gain during pregnancy. So we must ensure adequate fetal nutrition and advise women not to diet to lose weight during pregnancy. So, okay. So So a weight gain of 11.2 to 15.9 kilogram is recommended as an average weight gain in pregnancy. So remember, it is 11.2 to 15.9 kilograms. So we must advise women not to diet to lose weight during pregnancy because you have a baby inside you. So make sure to gain nutrition that will be good for the women and for the fetal. So a woman who reaches the midpoint of pregnancy and has gained less than 10 pounds needs to have daily nutrition intake reevaluated as low weight gain is associated with fetal growth restriction. So there are also um, a minimum of zero point 0.5 pounds per week or 11 to 15 pounds total to help ensure adequate fetal growth for the obese women. So we must encourage women who are pregnant with multiple fetuses to gain at least 1 pound per week for a total of 37 to 54 pounds because yeah. And sudden increase in weight suggested fluid retention or we call hydramnios, which is a loss of weight, suggests illness and should also be carefully evaluated at prenatal visits. So these are the normal pre-pregnancy BMI for the underweight under, so 18.5, so normal weight, overweight, obese, or morbidly obese above. So in the average woman, weight gain is considered excessive if it is more than 3 kilograms a month during the second and third trimesters. It is less than usual if it is less than 1 kilogram per month during the second and third trimester. So it is excessive if it is more than 3 kilograms a month. So here is a game called Correct Me If I'm Wrong. So in this statement, so the mechanics of this game is that in this statement, you are about to identify if there are a mistake in the statement, and if you spot a mistake, then correct it with the right answer. So for the first one, we have a weight gain of 13.2 to 16.9 kilogram is recommended as an average weight gain in pregnancy. So if this is correct, then no need to correct it. So if there is something wrong on the statement, then kindly correct it. Okay, so in number one, there is a mistake, which is the 13.2 to 16.9 kilogram. So if it is a mistake, then what is the correct answer on that? Yes, you're right. So this is the incorrect word. So the correct answer is 11.2 to 15.9 kilograms. So that is the recommended average weight. Average weight. So the next one is a weight gain is considered deficient if it is more than 3 kilograms a month during the second and third trimesters. So is it a correct statement or incorrect? Yes, you're right again. So the second statement is wrong. So there is something incorrect in that statement. So what it is? Anyone? Uh-huh, you got it. So the incorrect word is deficient. So if the word deficient is incorrect, then what is the correct answer or the correct word in order for the statement to be called correct? Diba? Mm. Yes, you are right. It is excessive because weight gain is considered excessive if it is more than 3 kilograms a month during the second and third trimesters. So we're about to go with the third one or the last one. So it encourage women of childbearing age to follow a healthy nutrition plan before pregnancy. So is it correct or there's something wrong in the statement? Yes, it is correct and there is no need for us to correct the correct statement. So these are the components of healthy nutrition for the pregnant women. So women will not have to increase by much the quantity of food they eat, but they will have to increase the quality of food. So kunwari sa mga things, we have a saying that quality comes with a price. And in nutrition, quality of food is important than the quantity of food that they will eat. So it gonna it doesn't matter if you eat a lot or if you eat a small amount, but what matters the most is that you will eat a food that has a good quality instead of eating a lot of food without that much quality. So unscramble time. So these are the words we need to unscramble. So the mechanics of this um, The mechanics of this game is that there are words listed and you are about to rearrange the letters and form a correct answer that is related to our topic, which is the components of nutrition. So, anyone who would like to guess? Any wild guess? Okay, how about the second one? Mm-hmm. Third one. Yep, let's see on the next slide. Mm-hmm. So, who would like to volunteer too? Yes. Second to the last. Oh, there's something in your mind, but make sure that it is related to our topic. Yes. And lastly, so in order to know if your answers are correct, we are going to the next slide. So here it is. The components of healthy nutrition for the pregnant women are the energy or calories needs, the protein needs, fat, vitamin needs, mineral, fiber, and fluid needs. So we will discuss each one of this. So energy or the calories needs. So a women, so a total caloric intake of 2,500 calories is recommended to meet the increased needs of pregnancy. So if you saw the table earlier, so let's go back to it. Okay, so um, we'll check it later. So there is on the table you can see that there is a recommended food for the normal women, for the obese women, for the underweight women, and for the average women. So for the average women, this is 2,500, or for the pregnant women, sorry. So for pregnant women, the recommended intake for the calories is 2,500. So this increase provides calories to sustain an elevated metabolic rate in the women from increased thyroid function and increased workload from the extra weight she must carry. So we nurses must advise women to obtain calories from complex carbohydrates, which are cereals and foods, which was tackled on our first year days on the biochemistry about the about these carbohydrates. So even if a woman has surpassed her target weight before the end of the third trimester, encourage her not to restrict her caloric intake because there are some changes in her body that um, cannot be adapted that easily. So next is the protein need. So the need for protein increases to 71 grams daily for the pregnant women. So if protein needs are met, overall nutritional needs are likely to be met as well. Why? Because most of the food or nutritional needs contains protein, which is the meat, um, the eggs, like that. So a woman with a family history of hypercholesterolemia should not eat more than 2 or 3 eggs per week because it has. So we know that egg has a high cholesterol when being intake more than the prescribed serving. So we must encourage such women to eat the meat to cook with olive oil instead of lard or butter because olive oil has a low cholesterol compared to the lard or butter. So the fat needs is that only linoleic acid, which is an essential fatty acid necessary for new cell growth, cannot be manufactured in the body from other sources. So commonly, a prenatal vitamin is prescribed during pregnancy to be certain that pregnant women ingest sufficient vitamins. And these vitamins are the vitamin D, the vitamin A, and vitamin C. So vitamin D is essential for calcium absorption. When lacking, can begin to diminish both fetal and maternal mineral bone density. For example, found in fortified milk, cheese, egg, and salmon is essential for calcium absorption. It's essential for calcium absorption, formation of bones and teeth, and possibly for immune system functioning. So in vitamin A, it is necessary for new cell growth, healthy skin, oral health, and vision in dim light. And this is the substance necessary because it because if it is deficient, this results in tender gums or tongues, cracks at the corner of the mouth, and poor night vision. Vitamin A is found in dark green and yellow vegetables and fruits and in animal sources such as liver, milk, butter, cheese, and eggs. So in vitamin C, it is an antioxidant vitamin needed for the formation of collagen in both the mother and fetus. It is also improves absorption from the woman's stomach and increases her resistance to infection. It is found in many fresh vegetables and fruits. So here are the mineral needs. So why do we need minerals? It is because minerals are necessary for building new cells in a fetus, and this includes calcium and phosphorus. These are both necessary for calcification of fetal bones beginning at about week 12 of pregnancy. The recommended amount of calcium during pregnancy is 1,300 milligrams. With an adequate calcium, a fetus will receive the needed calcium for growth and mineralization of the fetal skeleton without taking any away from the maternal bones or teeth, because tooth growth begins as early as 8 weeks in uterus, and these minerals also contribute to this formation. So most foods high in protein are also high in phosphorus. So by eating high protein foods, women receive enough phosphorus, also important for bone growth. So they are linked with each other. So iodine. Iodine is essential for the thyroid gland to be able to produce thyroxine. As thyroid function increases during pregnancy, a woman needs to ingest enough iodine during pregnancy to supply this increased need. So the dietary recommended intake for iodine is 220 grams daily during the pregnancy. So next. So iron, iron, women needs iron to build an increased red cell volume for herself and to protect against iron loss in blood at birth. Because we know that when we are giving birth, there are a lot of blood loss. So they needed to build this high level of hemoglobin, and a woman needs iron to build and increased red cell volume for herself and to protect against iron loss in blood at birth. That is what I said earlier. And the dietary recommended intake for iron for pregnant women is 27 milligrams. So iron absorption increases in an acid environment. So eating iron-rich foods or swallowing iron pills with ascorbic acid found in orange juice may increase absorption. That is why more ka ng mga aslom-aslom ang acid, di ba? So that um, so fluoride. So fluoride aids in the formation of strong teeth. If pregnant women should drink fluoridated water because a woman, also a woman should not take the supplement more often than prescribed, and if that was and not if and that, a woman should not take a supplement more often than prescribed, and not if that when water in her area is already fluoridated. So sodium. Women should use moderation with foods that are extremely salty, such as potato chips or foods with the additive monosodium glutamate. Why? Because too much salt could result in retention of excessive amounts of fluid, putting a strain on her heart as blood volume doubles. So, sodium is a major electrolyte that acts to maintain fluid in the body. Retaining enough fluid during pregnancy in a maternal circulation is important to ensure a pressure gradient to allow optimal exchange of nutrients across the placenta. So zinc, this is necessary for the synthesis of DNA and RNA, and so is important for fetal growth. So this is the most people who take inadequate protein also take inadequate zinc. So they are also linked with each other, right? So that daily recommended, diet recommended intake for zinc during pregnancy is 12 milligrams, or an increase of 3 milligrams over pre-pregnancy needs. So fluid needs. So extra amounts of water are needed during pregnancy to promote kidney function. So because a woman must excrete waste products for two, so you need a lot of water because there are also you have a baby inside you that also excretes waste. So you too, as a woman, so you will double like the food you need to take. You must double it. So 2 or 3 glasses of fluid daily over and above the 3 servings of milk recommended by the food pyramid is a common recommendation during the pregnancy. So you can hear this in the common pregnant women that you must drink glasses of fluid 3 servings because this is also taken in the food pyramid. So we already know what is food pyramid, right? Okay. So that ends my presentation. And the next reporter will talk about the foods that must be avoided during the pregnancy. So, Tara?
Good day, everyone. I am Tara Isabella Saison. So, we will now proceed with our last subtopic, which is food and activities to be avoided. So, before we start the discussion, I would just like you to play a game. So, I know a lot of you is already familiar with 4 picks 1 word, but for those who doesn't, here is the mechanics. So 4 pictures will be displayed linked by 1 word. The player's aim is to work out what the word is from a set of letters given below the pictures. Okay, so the game is very easy and I hope that you are ready now. So shall we now start the game? So we have here 4 pictures. You try to guess what this picture depicts. So you can try to pause this video and try to guess the word for as long as you can. Okay, so are you ready now to check the answer? Okay, so let's check. So if your guessed word is food, then great job, you are correct. So foods to avoid during pregnancy will be one of the things that we will be discussing for today. So I hope that you are now ready to listen with the discussion. So just sit back and listen. So first we have foods to avoid during pregnancy. So being certain with the foods that you eat when you're pregnant is very important, as everything that goes into your mouth gets shared with your growing baby. Even though some types of food and even some types of food poisoning may not hurt you, but they may hurt your little one. And during gestation, exposure to certain food-borne illnesses can have serious consequences for the unborn babies. That is why being certain with the right foods is essential for the health and safety of the growing baby. So first on the list is alcohol. So alcohol is not safe during pregnancy. Therefore, alcohol should be avoided as prenatal exposure to alcohol can interfere with the health development of the baby. So alcohol can also lead to fetal alcohol syndrome or other developmental disorders. If a woman consumes alcohol before knowing that she is pregnant, she should immediately stop drinking, and she should continue to avoid alcohol during breastfeeding, as exposure to alcohol in an infant possesses harmful risk, and alcohol also does reach the baby during the breastfeeding. The next we have caffeine. Although most studies shows that caffeine intake in moderation is okay, caffeine should also be avoided as it increases the risk of miscarriage, premature birth, low birth weight, and withdrawal symptoms in infants. So caffeine is a diuretic, which means it helps eliminate fluids from the body, and this can result in water and calcium loss. So caffeine should be limited to fewer than 200 milligrams per day during pregnancy. Okay, the next we have raw meat and shellfish. So raw meat and shellfish, such as oysters, mussels, and clams, should be avoided as they may be infected with toxoplasma or salmonella. The salmonella are a group of bacteria that can cause gastrointestinal illness and fever called salmonellosis. And toxoplasma is a protozoan parasite that causes the disease toxoplasmosis. Infection usually occurs by eating undercooked, such as raw meat and shellfish, and it can also be acquired through exposure from infected cat feces or mother to child transmission during pregnancy. Then we have deli meat. So deli meat should be also avoided as they may contain the bacteria Listeria. So Listeria are bacteria that causes serious gastrointestinal infection, usually caused by eating food contaminated with that bacterium. And this bacterium can cross the placenta and infect the baby. The next we have fish with high levels of mercury. So pregnant women should avoid fishes such as shark, king mackerel, swordfish, and pilefish as they contain high levels of mercury. Too much mercury could harm the baby's developing nervous system, and the bigger and the older the fish, the more mercury is likely to contain. And although canned junk like tuna has lower levels of mercury, it's still smart to eat it sparingly. So again, I will emphasize that even though canned junk like tuna has lower levels of mercury, pregnant women should also avoid it because it's not completely safe. So there is still a risk of eating canned junk like tuna. Then we have smoked seafoods. So pregnant women should avoid smoked fish such as lox, kirkfish, jerky, or Nova-style salmon as they may be infected with listeria. However, smoked seafood such as shelf safe or canned is most likely fine and safe to eat. The next we have raw eggs. So raw eggs may also contain salmonella, so pregnant women should avoid eating it raw and partially cooked, such as eggnog, raw butter, and freshly made or homemade hollandaise sauce and Caesar salad dressing. Then we have soft cheese. So soft cheeses and unpasteurized cheeses such as Roquefort, Feta, Gorgonzola, Camembert, and Brie should also be avoided as they may be infected with Listeria. The next is unpasteurized dairy. So Unpasteurized dairy should also be avoided as just like soft cheeses, they may also contain listeria. Then lastly, we have unwashed vegetables. So as vegetables may become contaminated with toxoplasma, pregnant women should avoid eating unwashed vegetables. So you have to make sure that you wash the vegetable first or cook it before consuming it. So before we proceed with our next topic, I want you to first tell me if this statement is true or false. So we have here our statement. Canned junk like tuna are completely safe to eat for pregnant women. So what do you think is the answer? Is it true or false? So you can pause this video so you can have a longer time to answer. So what do you think is the answer? Is it true or false? So you will find out. Okay, so the answer is false. So although canned junk like tuna has lower levels of mercury, it is still smart to eat it sparingly. Okay. Then next, we will be discussing about the activities to avoid during pregnancy. So although physical activities are considered good for a pregnant woman and the developing baby, however, there are some activities during pregnancy that should be avoided to ensure the baby's safety, especially activities that increase the risk of trauma to the uterus. So first on the list, we have running and jogging. So running can be risky and might also cause premature birth if complications in pregnancy arise such as bleeding, placental problems, or preeclampsia. So pregnant women should be advised to avoid running and jogging. Then we have bicycling. So since there is an increased risk of falling and accidents during bicycling, pregnant women should avoid this activity. And then we have overheating and hot tub baths. So pregnant women should not sit in saunas or hot tubs for more than 10 minutes because this could raise the body temperature to higher level, which may lead to abnormally high body temperature, resulting in hyperthermia or several other congenital abnormalities. Then we have weightlifting. So heavy lifting, standing for long periods of time, or bending a lot could increase the chances of miscarriage and preterm birth or injury during pregnancy, especially if a woman has a history of miscarriage or pregnancy complications. So they should be advised to avoid such activity. Then we have skiing. So skiing should also be avoided as it increases the risk of falls leading to significant injuries. So skiing is not recommended for pregnant women. Then we have scuba diving. Scuba diving is not recommended during pregnancy as scuba divers must decompress as they return to the surface of the water. And developing babies may not be able to decompress and have the difficulty, which may lead to birth defects and preterm birth. Then we have high impact aerobics. So although low impact aerobics is very beneficial, high impact aerobics such as jump ropes and push-ups are not recommended because of the extensive jumping, hopping, and bouncing during the routine, creating a risk for falls and injuries. Then we have recreation sports. Contact sports such as volleyball may pose a significant risk of trauma to the abdomen, so it should be avoided for pregnant women. Then we have activities during pregnancy with risk of falling. So ice skating, rollerblading, rock climbing, and all other activities I mentioned before that increases the risk of falling and injury should be avoided during pregnancy. Okay, then we have here a note. So there are a lot more activities to be avoided during pregnancy. That is why, before engaging in any physical activity, it is important to visit a healthcare provider to discuss the situation and evaluate together what activities are safe and what are not. So it is very important to consult first a healthcare provider before doing certain activities for the sake of the pregnant woman and the developing baby's wellness. So before we end the discussion, I would just like to refresh your memories from our previous discussion through a question. So you try to guess the answer. So I have here the question. So it is a type of aerobics that is not recommended for pregnant women because of the extensive jumping, hopping, and bouncing during the routine. So what do you think is the answer? So we have here our choices. A. Dancing. B. High impact aerobics. And C. Swimming. So you can pause this video and try to guess for the answer. Okay, so if you are now ready, let us now see the answer. Okay, so the answer is B, high impact aerobics. So if your answer is B, then you are correct. Then we have here our references. So we have the printed material and the non-printed materials. Okay, so that is the end of our discussion. So I hope you learned a lot from our discussion, and I hope that you will be able to apply all those learnings as a future healthcare provider. Thank you for listening, stay safe, and have a great day.